My name is Lara Hager, and I'm going to present to you Faye Abdellah's nursing theory. It was titled 21 Problems. The objectives outlined in this presentation are intended to educate the reader about Faye Abdellah, allows them to develop an understanding of her concept, the 21 problems, the application and everyday use, and provide current research and practice regarding Abdellah's theory. Faye Abdellah was born March 13, 1919 in New York City. At the age of 18, she and her brother witnessed a tragic historic event, the Hindenburg Zeppelin disaster, and that inspired her to become a nurse. She graduated from Ann May School of Nursing with a diploma in nursing, and she went on to earn her master's and doctorate degree from Columbia University. She was a nursing instructor at Yale from 1945 to 1949, and she had went to the dean to get new books. She felt that the books were outdated. She wanted new material, and the dean denied her the new books. So she proceeded to take the books into the courtyard and she burned them. So that got her fired, but she went on to become the first woman to serve as the U.S. Deputy Surgeon General for the United States. She worked under the Surgeon General to provide public input regarding disease and prevention, and she was inducted into the ANA Nurses Hall of Fame in 2012. Abdellah defined nursing as client-centered care. The care was to not only encompass the disease and the treatment of the disease, but at the patient and the patient's needs as a whole. The nurse needed to tune into her patients and develop a trusting, therapeutic relationship. The 21 Problems theory consists of 21 problems. The first one being to maintain good hygiene and physical comfort. Nurses do that every day, giving baths and making sure all the patient's physical needs are met. To promote optimal activity with exercise, rest, and sleep, we ensure that our patients are comfortable and that they're able to ambulate and move around accordingly. Promote safety through prevention of accident and injury. We do that with bed alarms and gait training, make sure that they're able to get to and from the bed to a chair and whatnot, make sure that we're with them when they do so if they need it. To maintain good body mechanics to prevent and correct deformities. We do the same with physical therapy and bracing, make sure that they're properly aligned, that they don't fall or hurt themselves. To facilitate the maintenance of a body of oxygen to all the body cells. And we do that by checking oxygen saturation and providing oxygen supplementary if they need it. Number 6 is to facilitate the maintenance of nutrients of all body cells. And we do that by providing proper nutrition and making sure that their diets are according to what's going on with their body. If they're diabetic, they need to have a low sugar diet. If they are a renal patient, they need to have low sodium. Continued on, problem number 7 is to facilitate the maintenance of elimination. We do that providing stool softeners, laxatives, those types of things. To facilitate the maintenance of fluid and electrolyte balance, we provide IV fluids and potassium supplements and other supplements as needed. To recognize the physiological responses of the body to disease conditions, the nurse has to be keen on picking up issues that a patient with diabetes or renal insufficiency would suffer from, so the nurse needs to be educated on those types of issues. To facilitate the maintenance of regulatory mechanisms and functions. To facilitate the maintenance of sensory functions, making sure your patient has their glasses, make sure their pupils are equal, round, and reactive. If they have hearing aids, apply those to the patient. Number 12, to identify and accept positive and negative expressions and feelings and reactions. Sometimes nurses tend to just, kind of comfort the patient and sometimes disregard their feelings. We just need to be sympathetic and take all feelings into account and listen to what the patient's trying to tell us. Problem 13 is to identify and accept the interrelatedness of emotions and organic illnesses. 14, to facilitate the maintenance of effective verbal and nonverbal communication. Number 15 is to promote the development of productive interpersonal relationships. So working again with the patient and other staff members and developing that trust. 16 is to facilitate progress towards achievement of personal spiritual goals. Working with the patient, providing a chaplain if they need it, and just making sure that their spiritual needs are met as well as their physical. 17, to create, or maintain a therapeutic environment. 18 is to facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. And again, that's just getting to learn your patient as a whole, as a person, not categorizing them with a group of people. 19 is to accept the optimum possible goals in light of limitations, physical and emotional. That's just understanding what your patient is actually capable of doing, not what you think that they are capable of doing. Number 20 is to use community resources as an aid to resolve problems arising from the illness, and we do that every day on my acute care floor. We work with our patient care facilitators to facilitate bedside commodes, crutches, medications, drips, things like that that the patient might need when they go home. And 21, the last one, is to understand the role of social problems influencing factors in case of illness. And that was another thing that Abdellah kind of focused on, was that there are social problems could be the cause of the physical ailments. If a person is financially strapped and they can't afford their medications, then it's going to affect their physical well-being. The major premise behind her theory was client-centered restorative care. She wanted preventative care. She was big on education. And to focus on the client's total needs, not just the illness. The key concepts recognized are problems can be physical, emotional, or sociological. She developed overt and covert to categorize her problems. Overt were things that were more apparent, more physical. If somebody had a broken leg, that's an overt problem. That's something you can see and you're going to treat. But that may also be a cause because of a covert problem. Maybe when they get home, they have no ramp to get into the house. Maybe they need crutches to get into the house. Maybe financially they're the primary breadwinner and they need help, from friends or family. So she thought that solving the covert could sometimes solve the overt problems. Cultural considerations. Abdellah realized that there's different cultures and different needs for every patient. It's relevant to culture in that the patients, are individuals. Some are Spanish speaking. A lot of ours are Spanish speaking. So the nurse is required to have critical thinking and recognize those considerations and make them. Does this patient require a translator for me to communicate effectively? Is therapeutic touch going to be appropriate with this patient or not? The National League for Nurses has a set of 4 BSN competencies, and I believe Abdellah's theory, something fits into every category. The human flourishing competency, Abdellah's theory shows incorporating skills and knowledge to help others, and then focusing on patient-focused care. Nursing judgment allows the nurse to be self-governing. Professional identity, the nurse should be caring. Advocacy, quality of care involving patients and families. And then spirit of inquiry is seeking knowledge and being flexible in an ever-changing field. Abdellah versus Henderson. I decided to compare Abdellah's theory, 21's problems, with Virginia Henderson's 14 needs theory. And they pretty much are the same. They're both patient-centered care, return patient to optimum level of function, prevention, education. Abdellah kind of focused on emotional and social well-being and nurse-related problems, where Henderson focused more on the physical needs of the patient. These were needs that the patient had to meet themselves. And it wasn't so much nurse-oriented. The nurse needed to recognize these physical problems, but it was the patient's needs themselves. Was her theory logical? I believe it was. Most of the problems identified in this theory are common sense in regards to nursing care. Therapeutic communication is important in maintaining physical needs as well as emotional and sociological needs. Critical thinking is essential quality, and nurses must develop it when faced with a variety of problems. Current research, patient needs. Abdellah was big on patient needs, client-centered care. A journal article I read, meeting patient needs in the hospital setting, are written nutrition education resources too hard to understand. The study was conducted to determine if educational information regarding special dietary requirements was effective in patient teaching. Were the patients able to understand the written material and follow it accurately? It incorporates Abdellah's facilitation of developmental needs, the socioeconomic factors, as well as aid from the community resources. The issue with the study was that there were patients who were given special diets, either for blood sugar issues or for diabetic issues, for renal issues, low sodium, and for warfarin or Coumadin diets. So, did these patients really understand what was required of them once they got home? Was the teaching material effective? And it required the critical thinking of the nurse to evaluate the patient once the teaching was done. Did the patient understand, and what did they take away from that, and did they need further teaching in regards to it? Abdellah's theory and current practice. 21 Problems and Abdellah have changed nursing education as we know it. Patient-centered research, evidence-based practice is the norm. Preventive care and social involvement in health issues. The nursing art and science encompasses the patient and family as a whole, and it's moved away from the disease, science-focused care as it was back before she developed this theory. Nurses assess, plan, we intervene, we assess again, and we evaluate our patients. Nursing implications. The nurse must learn the patient. What's their baseline? Is it this normal for this patient? Is it not normal? The nurse needs to distinguish between relevant and irrelevant materials, data. This patient's heart rate's up, and back again, is this the patient's norm? The nurse must identify and evaluate needs. Does this person need a beta blocker because their heart rate's so high? The nurse must identify a plan of care ensuring involvement of the patient and family. Adequate skill set is important, and Abdellah really put an emphasis on this. The nurses have to have a certain set of skills to be able to care for these patients, as well as critical thinking skills. Evaluate the patient's response and the outcome, and refer the patient to outside resources when necessary. If you recognize that is a need, then it's your responsibility to help fill that need for the patient. So in conclusion, Faye Abdellah devoted her life and career to the nursing profession and public health. Her research and development of the 21 Problems theory has changed the nursing framework of nursing education. Nursing has gone from a science and disease-focused field, and it has shifted to a client, disease, and client as a whole field. It's also emphasized evidence-based research and using essential critical skills thinking. And then this is my bibliography.